Good evening, everybody. This is Emily with New Teeth Now. Thank you for joining our webinar tonight. We do appreciate you taking the time out to come and watch us. So what are we going to be talking about today?
We are going to be talking all about implants and a lot about implants, especially focusing more on the full mouth replacement. So when we can replace everything in the upper jaw, everything in the lower jaw, or everything in both jaws.
What's different from the New Teeth Now procedure to other people that do this all-on-4 procedure?
I think there's a lot of differences between what we do and some of the other, some of our other competitors, from the style of the teeth, the material the teeth are made from, having the procedure done totally under general anesthesia. So you're asleep, it's comfortable. We try to make it as pain-free as possible, and the environment. They get me, they see you, they get the small town feel of this office versus a corporate office.
Because we get that question a lot, why don't we have other facilities like everywhere? And that's because we have everything here in this one building.
Yes.
Correct?
And that's a good point. That's another huge difference between us, because we have everything here, from the implant coordinators to the lab that's in-house. So the teeth are actually manufactured here. We have the surgeons are here, anesthesia teams here, the surgery's done here, the restorative doctors are here, so your teeth are actually made and the whole team is here. So if there's any question that our patients have about what happens with if this tooth is turned or my natural tooth is dropped down, we have the restorative doctor to look at it. And then you have the surgeon. Obviously, I'm here to look at the CT and kind of help come up with a treatment plan.
Well, I hope you're here.
Yeah.
That would be dangerous if you wasn't, because you don't want me doing the surgery.
Well, I don't know. You've seen enough of these. You probably could do some of them.
How many of these have you done? Let's just say this year alone.
One of our restorative doctors, Dr. Nafala, who I work with a lot on these cases. He and I were talking about it a couple of years ago. And at that time, we had well over 500. We kind of stopped counting at around the 500 mark. So that's a lot.
Yeah, and it's quite a modern procedure, isn't it?
It is a modern procedure. It's something that we do. I typically do these, as the patients come in that would need it done, but it usually ends up being somewhere 3 a week. So 3 days a week we'll be doing one of these procedures.
Wow. That's a lot. How many have you done today?
2 today.
You did 2 cases
Yes.
today. That's what I was trying to get at.
Did.
That's what I was thinking. In this last year, you must have done several.
Yes.
You probably can't even count.
Yeah, since the beginning of this year, the numbers have gone up quite a bit.
So you've been practicing implants for a long time.
Mm-hmm.
You're board certified, but you
Yes.
also specialize in Zygomatic Implants, which is a specialized type of implant. Talk to me a little bit about that.
So I'll talk to you about 2 things. The board certification, which I feel is important. We're all board certified. And whether you guys choose to come here or somewhere else, make sure that whoever's treating you is board certified, because it's kind of the only way that we have that we, as a specialty, gauge and hold people to certain standards of care. It's a pretty rigorous exam that we have to take and pass in order to become board certified, and we have to keep up with it. Every 10 years you have to recertify. So you can't. It's not like you just pass it and then, hey, I'm board certified and you're done. You got to still keep up with all the continuing education and all the new trends coming out to know what will work and what will not work, and make sure that you're up to the standard. With the Zygomatic implants, it's something that is not really routine in the United States, but it's something that is routine for us. Like today, the 2 cases I did all were Zygomatic implants. And what they are is your zygoma. The name comes from, the zygoma is the cheekbone. Mm-hmm. And the Zygomatic implants obviously get anchored into the cheekbone. And they're designed for people who do not have a lot of bone in the back part of the upper jaw. And it's really common. So people who've had dentures or severe periodontal disease and lost bone, or even, like me, when I've looked at my sinus or my CT scan, just the sinuses have expanded. Environmental allergies can cause that and stimulate that to happen. Or some people, it just happens. It's the way they're born.
So you're telling me that anybody that's been told they cannot have implants because they don't have the bone structure, because they don't have the bone, if they did have implants, they would have to have excessive work done. You are capable of doing them.
Yeah, and the cool thing about the zygomas, so for those patients who do not have a lot of bone, you can totally bypass grafting. And the procedure to do the bone graft and the time to let the bone graft heal, the zygomas replace that. So, and you can do it in one day. It doesn't just replace it as, omitting the need for the procedure for the bone graft and the 6 to 9 months for the bone graft to heal, but you can do everything in one day, which is, it totally changes the game for the patients.
And you said it's routine for you guys here at New Teeth Now, but not everybody is specialised in placing zygomatic implants.
No, it's something that it's not taught in every residency program, which I'm sure it will be sometime because the need for the procedure is real. And there's a lot of patients that do need it. And, we see patients from all over the U.S. We see patients from, from other countries that fly in to have this done because they'll see or they'll be researching and they'll come across our website on the internet or maybe see a commercial if they're vacationing here in Orlando, and they'll go back home and try to find someone to do it closer to their home, and they can't because they may advertise for it, but when you really, call them up or go in for a consult and you need the zygomatic implants, they don't do it.
Right.
So then they end up coming to a place like this.
And talking of all the out-of-country patients, I urge everyone to check out our website. So it's quite new, and we've got like a new theme to it and everything, and it looks great. And we have the travel section on there. So we can actually help you get here. A lot of patients say, well, how do I get there? What's the situation? And we've done it on several occasions, and now we have a place for you to visit and kind of investigate a little bit further.
Yeah, and the cool thing about where we're located, people like, where's Lakeland? But Lakeland, it's almost perfectly situated right between Tampa and Orlando.
Yes.
So you've got the choice of either airport. There's a lot of, nice hotels around our office. So it's very easy to get to, and it's right off of Interstate I-4.
And right between the two major parks, Busch Gardens, Universal,
yeah, exactly.
Disney.
And Disney.
Perfect.
Don't forget Mickey.
So you can have an entire transformation. Talking of transformations, have we got any before and after pictures of
We do, and that's what we're going to... Yeah, I guess we do need to kind of get to the slideshow. So, we can... Emily and I can sit and talk to you about what we do and how we do it and, how cool zygomatic implants are and what they can avoid. But if we can show you some pictures that you can see, and all these patients are patients that I personally treated. So they're not out of a book. They're not borrowed from, a website. They're my patients, and it's their before and afters. And I think to see the before and after, it just tells the story.
And some of them still come in to this day for checkups. And it's so odd for me to see them because I'm like, oh, I remember seeing you on the webinar. We did your picture, your before and after. And they'll look at me and they're like, oh, great. Can I see it? And I show them, and they're just like so happy that we use them.
Mm-hmm. It's cool. And all of our patients, or most of our patients, they ask, all their people on our commercials, and they'll say, hey, I've had all these problems in the past, and you've changed that for me. Like if I can, I want to be on a commercial, or use me in your
their life.
One of your webinars or seminars. But we'll go to the slideshow, and so just so you know a little bit about me, I'm from Kentucky, went to University of Kentucky for college and dentistry, and then did my residency, my surgery at University of Florida in Jacksonville. And like we talked about earlier, I am board certified, which is very important. A little bit about implants. They are recommended by the American Dental Association, which is our national association, as the best way to replace implants or teeth. And for those of you that do not know what an implant is, because there is some confusion about what people think they actually are. It's not the tooth. The implant is this silver structure here that looks like a screw that goes down into the bone, which is the yellow part here. Here's obviously your gum tissue, and then you've got this shadow of a post here. and that's the crown that gets cemented on. So there's 3 parts: the implant, the post, and the crown. And with traditional implants, if you're replacing just like one tooth, there's a time that you got to let those implants heal or fuse to the bone before you can put the tooth on. But what's really cool about the New Teeth Now procedure is you don't have to do that. And we can put the teeth on the implants the same day. So the day that I take the teeth out, put the implants in, we can put this bridge on, and this is showing one of the bridges. It's the lower jaw. And these back ones, they're not crooked. They're supposed to be tilted like that. And that does a couple different things. It makes the bridge stronger, and it avoids some certain anatomy in the lower jaw that we are very careful about how close we get with implants. But that's how we do it. And that allows us, and this is showing an upper. So it's nothing like a denture. This is a full bridge secured on implants that you can't take in and out. There's nothing covering the roof of the mouth. There's no wings that go up and underneath the gums or the lips or the cheeks. So it's like it's as close as you can get to having your natural teeth back and having fixed fake teeth.
So I just have one question, and the reason that I bring it up is because I think somebody that's watching today, I actually spoke to them on the phone.
Okay.
What would you say to somebody that's missing 6 or 7 teeth in a row? Like a whole bridge of 6 or 7 teeth. And they're kind of contemplating whether to do something like this or replace those teeth individually.
That's a good question, but it totally depends on that patient. Because there's a lot of patients that I would see that would be in that situation, that this would be by far the best treatment. Mm-hmm. And then because the surrounding or the remaining teeth are not in the greatest health from like a periodontal standpoint. And that, if you've got periodontally involved teeth, then your implants can be compromised if you put them close to those teeth.
And by
because that's an infection.
Yeah.
So periodontal disease is just a low-grade chronic infection that's always present, and it just is constantly melting away the bone.
So it's like a gum disease then?
It is, yes. And it's something that once it gets to a certain point, it's very difficult to treat. Like it's almost impossible to fix it without taking the teeth out. The cool thing about this is if patients are in this situation, and we take it, you can have the most severe case of periodontal disease, but the day I take those teeth out and clean the gum tissue, the periodontal disease is cured that day.
So it's completely gone.
Gone.
And they don't ever have to worry about deep cleanings, root canals,
it is
nothing.
It's gone, resolved.
Wow.
So, but back to your point, but there may be some people that have 6 or 7 teeth missing in one area and have really good teeth surrounding it. Mm-hmm. And that patient would not be a candidate for this. They would be one that I would encourage them to, let's just do maybe 2 or 3 implants and do an implant bridge to replace the area. And, so it makes a difference. And even though, I make a living doing this, but I don't have anything that's as good as what, God gave us. Your natural teeth there's nothing in the world, no one has anything that is as good as your natural teeth. If your natural teeth are in good shape. If they're not, this is the ticket. I mean, it's the best treatment that you can get.
And I love that you're so honest about that, because there are so many patients that walk through these doors that have been told that they need this, and then they've seen you and they're relieved because you've told them the truth and you've said to them, no, there's a different solution. So the really important thing is to just book a consultation, sit with him for an hour, and he's going to give you his utmost honest opinion. You're not going to get the, shipped around place to place or told one thing and then told another. He's going to be very honest with you.
Oh yeah, because at the end of the day, I have to go home and lay my head down, and feel good about going to sleep about what I did at work. And, that's what I honestly believe. And I would try to treat, I try to treat every patient the way that I would want to be treated. So, it used to be, if you look at the picture, we'll put it back up in a minute, but the upper jaw is showing 4 implants. And the procedure, if you Google and you're doing your homework, The procedure used to be called the all-on-4 technique. And those days are gone. I don't do the 4 implants. Everybody gets 6 implants on the top because that's what I would want, and that's what most of the current literature is showing. 6 is better on the top. 4 is fine in the lower jaw.
So you are already ahead of the game. People are still sat doing 4 implants, and you guys are just pushing through.
We are laps ahead of the game.
We always have been. I mean, I knew that from the minute I got hired here. So we do have one more question in. Somebody wants to know the link between infections and cardiovascular problems. The connection between the gums and heart and lungs.
That's a great question, and we talk about it during all of my webinars and seminars. But what the link is that chronic low-grade infection, the longer it's there, and if you think about it, it relates. I've got a slide coming up, but the bacteria that's causing the infection is constantly circulating through your blood vessels, and it eventually does work its way through the heart. So it can lead to, cardiovascular disease. It increases your risk of having a stroke. And it's so severe, and there's such a big relationship between the two, that I do a lot of facial trauma at Lakeland Regional, which is our level 2 trauma center here. And it's a busy hospital. And
this is on your day off, right?
Yeah.
Yeah.
On his
day off.
And at
That's
night.
what he does.
But what we'll get called from the cardiothoracic surgeons, that's a big name. I had to think about it for a minute. We get called from the heart surgeons that are planning to do like a valve replacement on one of their patients. And they will not do the procedure if the patient has periodontal disease.
Wow.
So it could be, you're talking about like a potentially life-saving surgery that they will not do until we clear them from an oral health periodontal standpoint. So that's a pretty big relationship.
Now, once the teeth are removed, you said that the periodontal is gone. So people can get this procedure where they get the teeth extracted and then get dentures, can't they?
Sure.
But do you see a lot of people that have done that and wish that they'd have just skipped that whole step and come straight to this?
Oh, all the time. The most common thing that I hear is, it may be just fear of the procedure. It may be financial, where, just not wanting to spend the money to do like the implants. So they're like, no, just take them out and I'll do dentures. I'll be fine. Like my mom had dentures, my grandmother had dentures. Like, I'll be okay. And then they realize they hate their dentures.
Right.
And they'll come back in 3, 5, 7 years later to do this. And it's the same comment. I don't know why I didn't do this 5 years ago. I've wasted all this time where I could have been enjoying and not really fussing with my denture, setting it on my nightstand at night, losing it, my dog ate it. There's just all these things that come along with a denture that, food getting caught underneath it, and it hurts to chew when food. So they got to excuse themselves from dinner, go to the bathroom, rinse it out. With these, you treat them like natural teeth.
That brings me to another question that we had, and somebody was asking, what's the comparison of the dental implants compared to natural teeth? And I think we've got a model over there. I don't know if you want to.
We do. So
flash it.
They're
so realistic.
My answer to that is that it's always different. If you've got great natural teeth, this doesn't compare. It doesn't.
That's true.
It's thicker. It's one piece. It's a bridge, so you still brush and you floss underneath. But if you don't have the best natural teeth, then this is it's an awesome appliance because it's one big.
I would just like to say I have natural teeth, and I wouldn't mind trading out for this, because with the root canals and crowns and everything else that goes along with natural teeth, I wouldn't mind doing a procedure like this just to kind of be done with it. Obviously, I know it's in the future,
yes,
but it's not something that I'm ruling out at this point.
No, and I'm not either.
No,
but
definitely.
What it is the very strong material. What we use for your final set of teeth is zirconia. So literally our lab upstairs takes a puck. Good. So it's a puck of zirconia like this. And it's called a puck because it looks like a hockey puck. But they mill it. A computer actually scans, everything's digital, scans it and mills out your bridge perfectly. And what this what our lab technicians do is they take this and make it into this. And Ted, I don't know if you can zoom into these, but when people ask me about these, the cosmetics of them, I mean, they're going to look as good as you want them to, as Hollywood white and perfect as you want, to we can add as much detail and characteristics to them that you want. I had a consult recently where, the guy, he's had gold, his front 6 teeth were gold.
Right.
He had gold caps on them. And that was important to him because that was him. And he didn't want to change his appearance and have just perfectly white teeth. So we talked to him, we can make gold front teeth. I mean, it's literally, they're all custom. So we make them look literally whatever you want them to look like.
I don't even think the model does it as much justice as when you see the patients with them in the mouth.
Sure.
I have literally seen patients walk through these doors and I've recognized them because they've changed so much. It's impacted their life in so many different ways that they've changed their hair or they've changed their makeup. And I haven't noticed who they were at first. And then I've realized, oh, wait, you had the dental implants, but you have no idea that they've got them in their mouth.
And what people also don't really pay attention to with teeth in general is, your eyes are usually the first thing that people look at, which we'll get into a little bit later when we talk about some cosmetic stuff.
If we get to the
slides. We get to that, yeah. But your teeth are next, because when you're speaking with someone, and I've been watching you sitting here listening to me talk, you're looking at my mouth. I'm kind of getting a little self-conscious about that, but that's what people do. And the teeth, when you can put the teeth in the right position, which we can with implants, and make people who have a really narrow arch, you widen it out. I mean, it really does change the overall appearance of the person. And you're going to see, I'm going to get to some of these slides. And then the other cool thing that I think Jason just told me that someone was asking about maintenance. That is a very good thing about these because you treat them like your natural teeth. You brush them with a toothbrush, toothpaste, a couple times a day, just like I do with my natural teeth. You want to floss them like I'm supposed to do every day.
See, that's what I was going to say. I've been staring at your teeth to make sure there's nothing in between them.
Yeah.
But you're good. You're good. Don't worry. They're good.
But the easy...
That doesn't happen with those, does it?
No. My 2 go-tos that I recommend everybody do with these: Sonicare toothbrush. Whether you have your natural teeth or you have these implant teeth, get a Sonicare toothbrush and get a water pick. It's the 2 best things that you can ever do to take care of your teeth, whether they're my implants or your natural teeth.
Yeah, I need to do that.
And then we recommend anything that's you can't take out and wash under, in a sink with soap and water, like a denture. You go get professionally cleaned by a dentist every, 6 to 8 months. You got to take care of them.
What would the cost of that be, just once a year?
Just whatever a routine cleaner.
Just like a routine cleaning?
I'd say the average is probably around $100.
So it's less than dental insurance?
Oh, yeah.
When you think about it, it's less than dental insurance. You're tempting me. Mm-hmm. I kind of want to have this procedure.
You just want to pay for the cleanings and have that done every 6 months, because anything you put in your mouth that you can't take out, the way your body's designed and your spit glands, the salivary glands empty in certain spots, and where they empty, you will collect plaque and calculus. That's just the way it happens. So if you can't take it out, it's something you can't brush off. You need a dentist to clean that for you. So you do have to take care of them. It's not an end all where, hey, you get these implants in, you never have to brush your teeth again. You have to take care of them, but it's very easy, and it's actually easier than it is with your natural teeth.
You see people that go a few years without doing anything though, don't you?
Yeah.
It
Yes.
happens.
It does, to the best of us, but...
We don't judge you.
Yeah, no.
It's okay. Just come in
we
and
take
get
care
them cleaned.
of you.
That's it.
All right, so your first visit is obviously you call Emily, and she could schedule you to come in for a consult where we get a CAT scan, and it's listed on there as an ICAT. And that gives me pretty much all the information I need about what you look like on the inside. I know how much bone you have and where your best bone is. And then from looking in your mouth and looking at the CAT scan, which we look at together, we develop a treatment plan and figure out how we're going to do what we need to do. So before and after, and
these are my favorite.
Yes, these, I can't tell you except just to show you. So this guy, you can look, he's got the little black spot on his gum, that's a draining infection. So, missing teeth, cavities, just a lot of stuff going on. But he came in and I took out all of his teeth, top and bottom, put in implants, and the guy walked out like that. So this is 1 week after, and when he came in for his first post-op visit with me. But that's just an incredible difference.
Amazing.
It's something that you can just look at the picture, and I can tell you that it really does change patients. It really does change your life. Because
I love that he's in all white in that final picture. He's like, I know my teeth are this white, and he asked for them that white.
Oh yeah, no, he wanted them as white as we could go, and and that's him. He had a great personality before we did anything to him, really outgoing.
Oh.
But now, he comes in when he used to come in for his post-op appointments. He would come into the theater and he would talk to everybody, smile, look at my teeth. Let me tell you what I had done here, and he would, and he was so proud of him, because it changed, really his day-to-day routine.
Mm-hmm.
This lady had a car wreck when she was younger, knocked out, broke all the front teeth on her upper jaw. Then they decayed, so we took them out, implants in, all in a day.
Wow.
That is, it doesn't even look like the same person.
Now tell me a little bit about her before, because I remember you telling me a story and you said that she wouldn't smile.
Oh yeah, no. Well, yeah, if you look at that before picture, you'll learn that I take a lot of pictures when you come to see me, but I would I was like, all right, give me a smile. And she wouldn't. And I was like, smile, just give me a smile. And she grinned just a little bit. I'm like, I need to see your teeth. And she's like, I don't know how to do that anymore. Aww. And then that's what she gave me. So she's like, I'll show you my teeth. And that's her smile.
Do you see that a lot with a lot of patients, that they're just
so
insecure and they don't even want to show their teeth?
All the time.
And then after the surgery, they're like different people.
Mm-hmm. Patients will come in for their consults, and even talking to me, they'll be kind of hesitant to, this is what I do, Mm-hmm. It'd be like going to, and this may be a crude comparison, but it'd be like going to your OBGYN and not wanting to take your pants off. They have to look.
Right.
That's what they do. And it's like, but I can't tell you how many patients I see for a consult. And I'm like, all right, we look at the CT scan, let me look in your mouth. And they're like, they're covering their mouth, and they really do not want me to look.
Right.
And it's like I see this all the time. It doesn't matter what you have in your mouth, I've seen worse.
You've seen everything.
And it's
right.
So people are really self-conscious, and if they're that way with me, who is the treating surgeon that's going to be taking care of them, when they're out to dinner or shopping or just around friends, they're always talking this way, eating with their hand over their mouth, or not going out to eat, avoiding going out with friends, and we hear that all the time.
If you are that person, you definitely need to schedule a consult just to come in and sit with him one-on-one, 100%.
So we kind of touched on this a little bit about why do patients typically come in to do this. I think the hardest part about patients doing the procedure is making that first step to call and make an appointment. So if you are thinking about it,
just do it.
Research it, go to our website, but just call and come in, because you're not signing a contract by coming into the consult. You can come into the consult and listen to what we have to say and just never come back. But I promise you, when you do come in, you'll probably end up scheduling. But most people do it, number one reason, to restore their total body health. Definitely, improve your self-confidence and bring out a smile. Makes it a lot easier to eat. Most of the patients that we do this on either have trouble eating because they have dentures, or their teeth hurt when they eat, or they're very sensitive. You're asleep during the entire procedure, so that makes it, for all you people who are just afraid of the dentist, you don't have to be, because you're asleep under general anesthesia. We have anesthesia teams that come in, so you're totally asleep. It can't get much easier than that.
What is the pain level like on a procedure like this?
Well, one would think that it would be very high and, difficult to control, but it's not. And it's very, very common for our patients to come back and they're like, Dr. Kirkpatrick, you gave me 20 Ortabs or 20 Percocets, and I took one. And then I just needed Tylenol or Advil. I didn't really need the narcotics. And that's pretty much our typical response. Now, there's some people that need the 20, and there's some people that don't need any. But most people need pain medicine the day of, and that's it.
Do you find a lot of people are suffering so much already and are sensitive to hot and cold because of their teeth?
Yeah.
That once they have this procedure, they're kind of relieved. More than anything.
Yeah, absolutely. That, the pain that they're having just on a day-to-day basis, the post-surgical pain is not even done compared to that.
Right.
So it's pretty nice for our patients.
It's pretty incredible because, like you said, I think a lot of people do assume that it's going to be way worse than it is. Everybody that I speak to.
Oh, everybody that comes in.
Everybody. And then afterwards, they're like, I wish I'd done this sooner.
And I would too. Knowing what I do,
yeah.
like the amount of work and the time and the surgery that is involved, you would think it would be. But patients have, I'll give you an example. If you had a set of twins, same shape with their teeth. One patient has all their teeth out in a denture. One patient has all their teeth out and these made. The person that gets this is going to have way less pain. The person that had the denture put in is probably going to go through their entire pain prescription and probably need a refill.
Wow.
And that's just the way it is.
Do you think it's probably from the denture being pressured onto the gums and not allowing
Well, I think that has something to do with it, and these are totally resting on implants.
Right.
But I think also the way that we do it with the kind of our new teeth now technique, by making sure there's no sharp edges on the bone, the gums are completely closed, everything's tight, there's no open wounds. It makes it as easy as it can be for recovery.
Brings me to another question. Does that decrease the risk of infection?
Yes. Mm-hmm.
Okay, so what is the risk of infection after this procedure?
Very low. Implants across the board are somewhere around 96 to 98% successful. Okay. So, for them to get infected, it's very, very rare.
And then what kind of medical issues would affect people from having this procedure? Like, would diabetes affect somebody from having it?
Diabetes can, but for the most part, no. If it's a patient that totally out of control, diabetes, then yeah, that can impede the healing. But we still do it, and you're still a candidate. We would just work with you to get your blood sugar somewhat regulated before, and we look at some other numbers too, like your A1C, because that gives us an idea about how you would heal and how long it would take the implants to actually fuse to the bone. But diabetes is not a contraindication. Okay.
Any other medical issues that you would say?
The only thing that I would say that I would really need to sit down and talk. We go extensively through through everyone's medical history. The only things that I would say that would possibly limit or restrict somebody from having something like this done would be some of the IV bisphosphonates. They're a really good drug for the people that need them, but they can really stop or impede the healing of and it's not just the implants. It's just having a tooth out or a root canal. Anything that you're doing something to the part of the tooth underneath the bone or the bone, that's a contraindication for some of those people.
But you said only some, because I know that we have had some people come in,
and it would be
and they're perfectly fine.
Everything every treatment plan is customized and curtailed to that specific patient. So, don't let that scare you away. I would still need to see you and want to talk to you about your medical issues.
So even if you've got medical issues, book the consult, sit with him one-on-one. The consult, and I'll tell you a price of a consult just before we even get there, it's just $50. $50 is nothing. We take it over the phone, we bring you in, we do a CT scan,
and that
full
includes
evaluation.
the CT scan.
Yes, it does. That does include the CT scan. And you will sit with him one-on-one, and he will go into detail, like he said, extensive medical history, and make sure that you're ready and healthy to have a procedure like this done.
The oral, for the people who are asking about heart disease, and this is kind of the breakdown. This is the rundown of how it affects and what body parts it does affect more commonly, but increase your risk: heart attack, stroke, diabetes, osteoporosis, the respiratory diseases like COPD and asthma. If you're inhaling, the mouth is that quote at the top of the screen. It's the gateway to an awesome creation, and it really is. But it's the first thing that encounters the food you eat and the air you breathe. So when you're breathing in, and you breathe in past a bunch of severe periodontal disease and infections, some of that gets sucked down into your lungs. I mean, it's as simple as that, and it stimulates, asthma to make you have a worse case of asthma or exacerbate like your COPD symptoms. Digestive diseases, you chew your food in a mouthful of periodontal disease, you're chewing it in bacteria and swallowing it. So, it increases all those digestive diseases. But the lowdown on it is just the more your body's fighting this low-grade infection, it reduces the effectiveness of your immune system, which can shorten your life expectancy. So periodontal disease is a real problem. And this is kind of showing you about what, and this is actually not a bad case. No. It's bad, but it's nothing to like some of the people that we see. But this needs to be taken care of. This patient needs dentures or implants. And, or just take their teeth out and have gums. They'd be a lot healthier than they would be keeping these in. Mm-hmm. But, that's showing what it looks like the day of. This is before the patient was awake, but that's taking the teeth out, putting the implants in. Those are impression pins that I've got on the implants. So these are the connectors coming through the gum tissue that's directly attached to the implants. And then that's it. That's what it looks like. This is before, this is immediately after.
Right, that's the same day.
This is same day. He came in the morning like that, left like that. And totally healthy mouth, new teeth.
She's changed him as a person. Even his smile is like more real in that final picture.
And what's cool about him, Emily, in that picture, he can walk out of the office and go home and eat dinner on those new teeth.
Talk to me a little bit about that, because we haven't spoken about that. So the teeth are done in a single day, but the first set of teeth are temporary. They're not these Zirconia teeth that we were showing.
So there's two sets of teeth that's included with a procedure. The teeth we put on are temporary teeth, and they're made of acrylic. Mm-hmm. You wear those for 6 months, and there's really good reasons that we do that. A lot of places will go ahead and put your final teeth on like the next day or the same day, and then they'll say, all right, catch you later, and you're done. Right. But the problem with that is your gums will shrink. We know that. So when we put if here's your gum level, we put in those temporary teeth, and it's butted up against the gums, your gums are going to shrink. So you get a little space in between the bridge and the gums. You're going to hate it as the patient. I'm going to love it as your surgeon because it's easy for you to clean. So while everything's healing, it's very easy for you to keep it super clean. Then once the implants have healed, which takes somewhere 4 to 6 months, then we make the final teeth out of zirconia. And, but when I say temporary and final, the temporary teeth still look really good. Our goal with the temporary teeth
Well, you can see it on that before and after.
Oh, yeah, those are his temporaries. Right. But what our goal is we want your temporary teeth to be what you want for your final.
Right.
So when you do come back to have the final teeth fabricated, you just say, hey, I love them, don't want any changes, duplicate them in the zirconia. But the other cool thing about that is if you do want changes, these are like your test drive set. You can change the color, you can change the size, you can change the shape. There's a lot of things you can change about the teeth. So you're not stuck from day one with what you have. So you like test drive them for 6 months. If you love them, we duplicate them and make them better material. If you want to change something about them, we can change it.
Yeah. And you don't get those final teeth until you're 100% happy, which is
Right.
really cool. And going back to when you said some places will put the teeth in your mouth and then that's it, they leave you, like, bye, have a good day. What they then do is they call you and say, would you like to upgrade to the Zirconia? Well, there shouldn't be an additional fee. We like to keep it all in one. So everything that we talk about here in this webinar is all inclusive, which is pretty nice.
And that is one thing that if you're shopping around, make sure you ask that, because that is very common for us to hear. I do a lot of second opinions, and I encourage second opinions. If you come see me first, hey, go see someone else. And, because we want you to be totally bought into the system and 100% sure that you want this and you want me to do it. And I'm very confident and comfortable that if you do go see someone else,
you'll be back.
I'll be doing your treatment. And I'm not being cocky by saying that. I'm not trying to come across that way, but that's what we see. And I know what we offer and what we do, and that's just the way it is.
There are too many places that are very deceiving. And we're not name bashers, so we're not going to call them out. Of course we're not.
Because
we
want to talk about how good we can do it, not how bad they can do it.
Correct. But it is important to do your research thoroughly and make sure all of your questions are being answered and make sure that everything is included. And it's really not the other facility's fault. It's just that they don't have the lab on site like we have. So they probably can't make the Zirconia all-inclusive, whereas we have the lab and the technicians
and the hands
and the surgeons that are able to do so. So just like he said, second opinions, research.
So if you want to be truly healthy, you got to at least think about your mouth. Who's a candidate? We've talked about this. No teeth or unhappy with your dentures, mouthful of bad teeth, severe periodontal disease. If you've ever been told that you don't have enough bone, you need to come see me. I've never had a patient yet that did not have enough bone to do this procedure, and that's very important. Before, this lady is an example of that. She didn't have enough bone for implants until she came to see us, and then she had enough bone for implants magically, because of the zygomas. We could offer that to her, and it really changed her outlook. I mean, her self-confidence went up. She loves her teeth. This lady had a denture. Teeth look good. You can't really tell. The teeth don't look that bad because it's a denture. She hated it. So we put in implants, went out in the parking lot, broke her denture. She threw it away and she never has to worry about it again.
Is that the one that stamped on it in the car, in the parking lot?
Stepped on it and broke it.
Parking lot.
Exactly. Before and after, these are right when he came back and got his final Zirconia teeth 6 months later. I mean, look at those, though.
Look at his smile. That's what I love.
And that's what I'm talking about the appearance of the face in general. You look at this, and then you look at him.
I know.
That's a big, big difference. Mm-hmm. Zygomas. Lady been wearing a denture on the top, a snap-on denture on the bottom. She'd been told by several other surgeons that she was not a candidate for implants. Just get used to her denture, invest in some glue, the denture adhesive, and she hated it. She came in to see me, and her comment was, I know there's nothing that you can do, but I just wanted to come and see. And we did them. Zygomatic implants, and that's her. After. Full set of implant bridge.
Changes the way they look. Like, to me, that doesn't even look like the same woman. Just because it's such a drastic change. Obviously it is. I mean, you can tell it is. But, just because she's taking care of herself now, she's so much happier.
That much happier, yes. This lady, came in, same thing. Had a lot of dental work in the past. A lot of root canals, a lot of crowns, a lot of bridges, all failing. And she had been offered a denture. Young, healthy lady. This person does not need a denture. So she needed zygomas. She came down, she's out of state, flew in, we did the procedure, and that's her. I mean, look at that. And these are showing,
have no idea.
I love this x-ray because it shows you, so your zygoma, your cheekbone is sitting here. That's a zygomatic implant, totally bypasses the sinus, but it gives her that. I mean, if you look at this,
you can't tell the difference between someone that's got traditional implants and somebody that's got zygomas.
Even a general dentist can't look in your mouth and see that you've got zygomas. They can on an x-ray because they look funny, but you treat them just like a regular implant. So the New Teeth Now Total Facial Makeover, I'm going to touch on this really quick. Another part of my practice is facial cosmetics. So we do everything from Botox, fillers, lip plump procedures, chin and cheek implants, brow lifts, eyelid enhancement, face lifts, neck lifts, and rhinoplasties, which are nose jobs. But the reason that I want to just touch on this is because a lot of our patients that need like this, they also have lost a lot of volume from bone loss.
Right.
And that's something that, you do this and put in a couple cheek implants on some patient that has a lot of volume loss, and it takes off 15, 20 years.
Right.
Just restoring that volume back to what it used to be. And so that's what I think also sets me apart a little bit from other places is with the training that I had, that I was lucky enough to get at University of Florida in Jacksonville. My attendings there were incredible. So from the trauma to the cosmetics to these full mouth reconstructions, we literally got it.
Well, the teeth make people look so much younger too.
Oh, and then you throw on a cosmetic, even like this lady.
Yeah.
Before and after. She came in 4 implants. She saw one of my little brochures that we did cosmetics here. Talked to me about that, and she ended up doing a full mouth implant procedure and a CO2 laser resurfacing of her face, of the skin. And she's all these little fine lines and wrinkles and the sunspots and the age spots and just even droopy eyelids. So we did that procedure, CO2, all the same day, all while she's asleep, and this looks like her younger sister.
It does.
It's just a big change.
And that's not a facelift.
No, that's just a laser resurfacing.
Wow.
This is a facelift. I'll run through some of these. Facelift. And what I do not do is I don't give patients like a plastic look. I don't want you to leave here and be eating at a restaurant and somebody be like, oh man, look at that. Why do you see that in a facelift? Or skin, like she's been in a wind tunnel or, hurricanes coming through, which does happen here. But we don't want your face to be, drawn straight, tight back. So, that's just a good natural improvement. Look at the profile.
Wow.
It doesn't look like she's had a lot of cosmetic surgery, unless you saw her before, and then, but, totally rejuvenated her. CO2 laser before and after, chin implant, 30-minute procedure. All this, she's just congenitally born this way, but chin implant, look at that. It's a huge difference. And then back to the implants, they're never going to need a root canal. They're not going to decay. They're very easy to maintain. We talked about the maintenance. And, the New Teeth Now procedure, the way we do it here, like that's just, if you look at her before and after, and she's so, and very well, how happy she is. She wants to tell everybody. She offers her personal cell phone to, patients considering it, because she wants to talk to them about, hey, this is what I went through. This is what it felt like after. This is what it was like a week after. This is when I went back to work. And, she's just so happy with what happened to her here. And we love hearing those stories. And we get to, we do get to know our patients because, I'm not seeing you every day, but we're getting to know you over a 6-month time period. And, it's just, we take pride in that because it's cool to get to know them on a personal level.
I think that starts right from the phone call. As soon as you call in and you talk to me or Grace or Shauna or Debbie or Nicole, we want to try and get to know you as much as possible over the phone before we even bring you in, and you'll get that feeling as soon as you call us. So, like I said, making a consult, making that phone call, it's super, super important. Let's talk about everything being under one roof.
Yes, let's do.
How we do the consult, the impressions, the surgery. So the fact that we've got the lab in-house is amazing.
Yes, it makes a big difference because we did a show in Tampa, the Morning Blend, and that was one thing that they were very impressed and hit on this morning talk show. And, it's very important for patients to know this, and it's something that I think makes a huge difference, because I feel like that we have the best of the best in each category here. So from, like talking to people on the phone and working through their fears. I know you do, and I do, and everybody does, but working through their fears to answer their questions and get them to come in. And, to the implant consult and the coordinators, making you feel where it's not like you're really self-conscious about being here, or scared about being here, or embarrassed about being here. And to, the restorative doctors we have, like, Dr. Nafala is just unbelievable at what he does. And patients love him. So typically our out-of-state patients, they'll come back to see him for their cleanings. Every 6 months, they'll fly in or drive in to see him from out of town, just because they're comfortable with him. To our lab technicians who are here in-house, and that's with the teeth being made here and the lab technicians here. If there's an issue or a patient has a question, we don't have to call the lab in California. We don't have to send them out and have something done and wait on them to come back, wait on the teeth to be shipped back. Usually the lab technician, or the lab artist is what I call them, can come out, look at you, talk to you, figure out what the problem is, and correct it right there on the spot. And that to me is priceless to have that here. And then the final teeth are fabricated here. So, the quality control checks are here. So nothing leaves the lab until we're happy with it. So that's important. The procedure is done in 1 day. We talked about the temporary teeth being acrylic and the final teeth being zirconia. And here are two of our implant coordinators, Shauna in the blue shirt and Debbie in the black blazer. You'll meet with one of them too, or possibly even Emily if you come in for a consult. And so you'll get to know these people here. That's Dr. Nafala. And that is a terrible picture of me.
Oh,
so we're
you
gonna
guys
move on.
Look so good. Go back.
That is my surgical staff. And, you'll get to know Corey, Amanda, and Shirley, because it is a small office. It's a very big office, square footage wise, because we have everything here. But it's a very small office and we want it to have that small office feel. So you get to know us on a personal level. And patients call in and be like, they'll ask for Amanda, hey, I need to call and schedule for my post-op appointment, or, my evaluation. So you'll get to know them. So our anesthesia team, Jack Daniel and Kim Cherry, they both have years and years of experience. They're very good at what they do. So they make it very comfortable and provide safe anesthesia. This is our entire team, and this is the office that we have in Lakeland. So, you can see that we do have about, 40-something employees, and that's what makes this place run. It is, we call it the dream team, and for good reason, because the way you can change patients' lives on a daily basis, it does make their dreams come true.
No, I agree with you. Thank you for watching,
Thank you guys for being on here.
Thanks, bye.
If you would like to view more informational videos on New Teeth Now, please click the subscribe button here. Thanks for watching.